Hi, my name is Kim Crumpton. I do the Blue Cross Blue Shield insurance here at Healthcare Express. I'd like to explain to you today some of what you're maybe looking at on your EOBs, urgent care versus PCP versus specialty. If you could look at the board with me, we bill for an office visit. One of our office visits is $215. Blue Cross Blue Shield allows $107.40. Blue Cross Blue Shield disallows $107.60. That means right off the bat, we have to write off this $107.60. What they're going to pay us is off this $107.40. Your copay is $35 on some policies, not all. Each policy varies with their copay, so it just depends on what your urgent care copay is. Your copay is $35. Blue Cross Blue Shield is actually going to pay us that's actually what Blue Cross Blue Shield is going to pay us is $72.40. So between the $72.40, your $35 copay, this is how we get our amount of $107.40. Now, if you ever have a problem where you don't understand your EOB or you feel like something was paid, not paid that should have been paid, you don't feel like it's your responsibility, by all means call up here and ask us. We will be glad to get you and your insurance company on the phone at the same time. That cuts out a lot of the confusion. If you were going to a regular doctor, say at one of the other clinics here in town, your copay might actually be just $25. But when you come here to an urgent care setting, which is what we are, you might pay a $50 copay or you might pay your specialty copay. Urgent care is just now coming on where they're getting their own benefits. So if you don't have urgent care benefits, you will have the higher copay as a specialty because that's what we fall under. We bill $215 to the insurance, knowing we're only going to get $107.40. But we have to bill consistently across the board with all of our insurances. Therefore, one insurance, we have a contract with Blue Cross Blue Shield, so they only pay $107, but another insurance might pay the whole $215. Now, what I'd like to explain to you is the Blue Cross Blue Shield federal plan's deductible. Each plan changes something every year. It might be minor, it might be major, and if you don't use that benefit, you may never know that it changes. But for Blue Cross Federal, we call once a year and find out what that deductible or changes have been, if any, towards these groups. So Blue Cross Federal, Group 104, and 105. This year, you have a $350 deductible. After you've met or satisfied that $350 deductible with urgent care, your plan will you will pay 15% of all charges after that. Now, with groups 111 and 112, you have nothing but a $50 copay with Blue Cross Federal for urgent care. This is the two plans that you have to choose from, or the four plans you have to choose from, and these are the benefits we found out. Now on your EOB, you'll see every time you get an EOB, we're about a week behind you. So if you get an EOB on one day and there's a refund or you have questions about it, 10 to 7 days before you call where we can make sure that we have the correct EOB. On your EOB, you should find the claim number. It's always important for you to keep up with what claim number and the date of service. And by all means, always read your EOB. If there's a charge on there that you don't, and we send you a bill that you don't quite understand it, if you'll call, we'll be glad to sit down with you.